How does VFA help diagnose osteoporosis? Imagine trying to find hidden cracks in a building before they cause serious damage. That's similar to what vertebral fracture assessment does for bone health. It helps doctors spot fractures in the spine that often don't cause pain or symptoms and can be missed during routine bone density tests. These fractures are important because they show that bones are fragile and more likely to break in the future. VFA uses a special type of scan called dual energy X-ray absorptiometry, or DEXA for short. This is the same machine used to measure bone mineral density, which tells us how strong bones are. But with added software, the DEXA machine can also take detailed images of the spine during the same scan. This means that while measuring bone density, the machine can also look for fractures in the vertebrae. Many vertebral fractures are silent. They don't hurt or cause obvious problems. Yet, their presence is a strong sign of osteoporosis. Detecting these fractures helps doctors understand a patient's true fracture risk. Sometimes, a person might have normal bone density numbers but still have fractures that increase their risk of future breaks. VFA helps catch these hidden issues, leading to a more accurate diagnosis. Adding VFA to bone density testing improves the chances of diagnosing osteoporosis. Studies show that about 1 in 4 patients undergoing bone scans have vertebral fractures that would otherwise go unnoticed. Finding these fractures can change how a doctor assesses risk and decides on treatment. If a fracture is found, the patient might be classified as having osteoporosis or a higher risk level, prompting earlier intervention. VFA is also very practical. It exposes the patient to only a tiny amount of radiation, about 1% of what a regular spinal X-ray would deliver, and takes just a few extra minutes during the same appointment. This makes it a safe, quick, and cost-effective way to get a clearer picture of bone health. Guidelines from health authorities recommend using VFA especially for postmenopausal women and others being evaluated for osteoporosis. It helps identify fractures that might otherwise be missed and supports a comprehensive approach to managing bone health. In summary, VFA enhances the diagnosis of osteoporosis by revealing vertebral fractures that are often silent but critical indicators of bone weakness. Detecting these fractures allows for better risk assessment and more targeted treatment plans. While ongoing research continues to explore its full impact on health outcomes, current evidence shows that VFA is a valuable tool in the fight against osteoporosis. Always remember, personalized medical advice from a healthcare professional is essential for interpreting these findings and planning appropriate care.